Honorable Dr. Bernadette Lahai, a member of parliament from Sierra Leone. Why did I join African Women Leaders Network on reproductive health and maternal mortality or child mortality? Why? I come from Sierra Leone, where for the past decades, Sierra Leone has registered the highest number of maternal deaths and under 5 mortality rates. And that was actually exacerbated after the war, when almost all the health infrastructures were damaged, and the problem also of accessibility to referral centers due to long years of neglect of feeder roads actually increase maternal mortality and under 5 mortality. This has become a big concern to us, especially as members of parliament, because most times in our constituency we face the challenge of either providing vehicles to evacuate women or children, or sometimes we even foot the bill when we are around. But even when we are not around, sometimes we are being called upon to give assistance from as far as the city where our parliament sits. And we are in this modern day where no woman should really die giving birth. And therefore, this is an issue that is dear to my heart. When I was approached by organizers of this organization, I did not stop to actually think whether I should join or not. I think every one of us, especially women, should be concerned about this important issue. I have 2 children, 2 daughters. I'm lucky that I gave birth without any complications. Not every woman is lucky. I was educated, or I'm educated. I knew the implications of motherhood. I knew what I should do or what I should not do. I knew when I should take all my vaccines, and I had the economic power to make sure that I prepared adequately for my 2 children. Not every woman, especially our mothers who live in the villages far away from any peripheral health center, who cannot access even the basic of health facilities, and therefore the chances is 50-50 when they are pregnant that they will give birth to a live child and at the same time stay alive. So this network is very dear to my heart. It's an advocacy network, and through this network we want the voices of many women heard. We want the voices of young adolescents, people, especially girls, heard. We want to also raise our voices, particularly to those policy makers who, knowing the situation, but maybe either due to underestimation of the situation or thinking that women's issues are not important. We want this network is there to ensure that our voices are heard at the highest quarter. So and since we joined the network, since it was launched in Uganda, I'm sure all of us in the network have have actually intensified our respective work on the issue of reproductive health. If I should be asked what I hope to see AWLN doing, or what are my hopes for the network. I still think that, particularly coming from Sierra Leone, the problem of maternal death is still very high, despite the many innovative programs that past and present governments are putting in place. The last 1 year, especially after the launch of the free health care for mothers and pregnant women, lactating women, and under fives, and the introduction of the emergency ambulances, where now every peripheral health center is given a mobile, and once they see a situation very critical, immediately they call, and within hours, depending on the distance and depending also on the nature of the road, a woman is evacuated by an ambulance to the referral hospitals, and that has actually really helped to reduce the maternal mortality as well as infant mortality, but it's still high when you compare to sub-Saharan average or other West African countries. So I think for me this is still an issue that I would want to further, I would want to give more visibility to in my country. Our First Lady has actually taken this issue as her own baby, as her own niche, and she's doing everything ranging from working with traditional leaders, working with school children, working with medical professionals to actually reduce this grave ill of society. I started a pilot work on actually teaching couples in my village the natural method of contraception. I started with a few couples, but I'm sad to report that while the women are willing to go along, the problem is always with the men who cannot actually wait, in the absence of contraceptive, particularly condoms, who cannot abstain within the unsafe period. This is something I really want to see how we can strengthen it, because being very far away from health centers and the difficulty of accessing health centers, access to family planning is a problem in those parts of my constituency. And I think that if couples are educated and motivated enough, in the absence of any of those modern family planning methods, we can use the natural cycle to actually help them in spacing their children or getting their children as and when they want. I'm happy that in this seminar, in this international conference, I listened very carefully to the bead method. We'll be using stones, but I think this innovative way of using the beads, that is something, if I have my way, I want more education on myself, so that we can push it, and we can also train maybe midwives in the villages, or even teachers or educated young girls in the villages, so that they can teach young couples using family planning using this bead method. I think I have a lot of faith in it, because it's more resourceful, in the sense that even when this bead is not there, we can also use other local materials to also get similar beads in a more innovative and more localized manner. So this is one thing that I want to take up, and I want to explore how we can train trainers, especially in villages, so that the problem of accessibility, the problem of transportation, sometimes the problem of unavailability of these family planning methods can be solved.